And for a little bit of additional background, I will just toss in that sort of what happened. First of all, I don't think I had time to mention, I do have an identical twin sister who's been in Silicon Valley since the 90s. So I always say she went into computer code and I went into genetic code, right? Since I majored in cellular molecular biology. But she got her PhD in human computer interactions in the 90s. So at the rise of the internet, which was really good timing, and ended up that she was at LinkedIn since it started, and ended up a VP at LinkedIn when they went public. So she helped take them public. And the reason I'm telling you that is because I had a lot more involvement in sort of watching the rise of technology, the internet. I was an early adopter on everything. And even early on, I started seeing some parallels between, for example, genetic code and computer code that otherwise people might miss. And if you look at now, actually, for those of you doing sort of health informatics and biomedical stuff, if you look at what the potential is now, people are hugely interested, right, in the ability to use modifications of genetic code and the fact that it can be, ATGC, just like you can get things to a binary level with a computer. That there's huge potential there, and also some huge ethical issues and things to go along with it. So basically, I had sort of more of a foot in that world than you might otherwise know if you just looked at my background and what I've done. But what it also means that I started doing things like I would go to the main TED conference. I got myself accepted to the main TED conference about 8 years ago. Which is hugely expensive, but it is a very mind-expanding week to do in terms of going and actually listening. I mean, you can obviously, my husband said to me, my husband's an orthopedic surgeon who's very sort of, I say cut and dry, like a surgeon, right? But he said, why would you pay that much money to go to a conference? You can watch all the talks online. And my response, which partly ties into this sort of theme of my talk, which is we are, human nature to be connected and in person and relationships, it's not just listening to the talks, it's listening to 80 talks in a week and meeting the speakers and talking about them and putting them all together and having breakouts that are all designed for interaction, which is why I figured I'd make this more interactive, because I come away each year from that, but I kind of come away as a whole with this sense of, okay, now I'm getting an understanding of everything from like cutting edge AR, VR, right? With all the companies coming from around the world to present the kind of leading edge at the TED conference, to the ethical issues around, the micro-targeted ads on Facebook, right? At the same time that I'm looking at how we're raising kids and what world are we raising them to succeed in, and what is our education system doing? And again, because I came from the health system, which doesn't always get tied into that, it was that mix, and it was a very interesting mix. So I saw someone on here, I think right at the beginning, Sharon, you said you're poli-sci and bio. When I trained in the 80s and 90s, right, in sort of undergraduate and then medical education, everything was straight and narrow, right? So I was cellular molecular biology, straight into medical school, straight into residency. And there wasn't this sort of mix and match mentality. Now, as people are shifting towards this idea of, first of all, engagement, which I did reference in my talk, and following your passion and your flexibility and your critical thinking skills, those things can be applied in a lot of areas. And so what I'm seeing, and again, you all can chime in a few minutes here or ask questions about it, is all universities are sort of racing to say, how do we shift education to allow people to do that? When I was studying, it would have been very hard to major in study political science and bio at the same time. I have 3 kids, 2 of whom just graduated in the last 2 years from college and one's still in college. And one of them went, I don't know if you've heard of Minerva, but my oldest, who I'm actually in Chapel Hill with now, is starting her graduate program here in public health, but she was at Minerva. So brand new university focused on 21st century skills, global citizenship, creativity, critical thinking. But she lived in 6 countries around the world. Every semester, the whole cohort picked up and moved around the world. That is an extreme on the education side for what I was referencing, which is we are globally connected, globally complex. You need to shift perspectives. It's got, global cultural immersion, but it's using technology for interactive classes, very much like this, where it's a flip the classroom. So there's no teacher lecturing at you. This is why I don't want to just sit and lecture and do a PowerPoint for you. But that's one version of what we see. And again, that's what everyone's watching in higher education, is this complete shift, which Minerva has been attempting, but she was in the first graduating class. So last year was the first graduating class from Minerva. Yeah. And my second one, my son, who I just finished moving in a couple days ago into DC area, just virtually graduated from Vanderbilt. And again, you take this sort of really esteemed, long-standing kind of elite university, and he was able to do a, sort of a humanities, he was in the humanities school, but he was a math computer science major who was able to get a minor in business. And again, that wouldn't have been possible before. The other thing, for better or for worse in the middle of a pandemic, is Vanderbilt, like most universities now, also offer way more opportunities to be globally involved, right? Semesters abroad, all sorts of interactive international. Seeing as how they were one of the earliest in the US to have their spring break, about 50 Vanderbilt students went to Spain only to come back and then test positive at the beginning of March for COVID, and then they all went home. So, but again, that's straining this idea of globalized, interconnected, travel the world, everything's a plane ride away. But again, for education purposes, you see it shifting that direction. And then my last child is at Arizona State University, which is the biggest public university in the United States. And it is meant to be more kids' first time to college in their family, make it less expensive, more accessible. And their theory is, and my twin sister consults for the president of the university there, which is, you come here, we'll get you the skills you need to do what you want to do. And that did not happen when I attended the University of Michigan. No one said, let's figure out exactly what you want to do, and then we can piece together all these things for you to be able to do that. So in that context, that's the education side I figured I'd jump into. I clearly have been hanging out in that sort of business world and sort of innovation, entrepreneurial side of things, in part through TED and some of the other things I've been doing. And in healthcare, just because I don't want to forget to mention it, since not as often do I get a chance to focus on the healthcare side of things, when we talk about things like engagement, right, and trust and relationships, people have actually done studies on patient outcomes. And, my husband, like I think I mentioned, orthopedic surgeon, but orthopedics tends to be an area that people spend time studying for a variety of reasons. And studying a cohort of patients coming in for hip replacements, which is what my husband does, do better when they come in as a group before the surgery, find out all the things they need to do for the surgery, they recover together. And I jokingly say, but I'm not really joking, it's sort of like the Weight Watchers model, right? You have a support group of people if you're trying to lose weight or you're trying to recover from surgery. And that support isn't just a nice to have. People are now starting to really put their fingers on, it's really important. Like, it improves outcomes, but at a measurable, tangible level. So it's not just the mental health and wellness side, but actual medical outcomes in the more traditional sense. So that's my big picture in terms of applying the skills. And then again, we can talk about each of the 7 key skills again or not. But let me see, does anybody have anything they want to chime in? Or Bhumi, do you want to, feel free to help me direct where you'd like this to go? Because again, I can just keep talking and then I feel like I'm talking to myself, and my kids are over in the next room. They're going to be laughing, going, oh my God, she didn't stop talking the whole time. But I am happy to make this interactive or direct this in I can take this in a lot of different directions. So feel free to type me some notes. And Sharon said family lives 10 minutes from ASU. Oh, gotcha.
Yeah, so I just wanted to remind participants that if you guys have any questions, you can raise your hand, or you can also send a message through the chat, and then we can ask for you as well.
And while we're doing that, oh, I have a question. Let's see. Is it Isha? I have a question. All right, I'll let Isha type it, and Maitri Patel, hang on, it's scrolling. How do you enable this global connected education idea in an accessible way for all social classes? That is a great question. And, I jumped into this space around sort of education and early childhood education and investing in early childhood with a very particular eye towards kids born into poverty facing adversity. I've also done some work internationally, and it's interesting because it always comes down to health and education. Like, when people have next to nothing, those are the things they strive for. And oftentimes they're interchangeable, or you have to give up one to get the other, right? I don't know if people know the book, The Last Hunger Season. I can't remember which country in Africa the setting was, but take your pick of a poor, farming village somewhere, and profiles, and it's true story, but profiles villages where families have to, starve to sell the food that they could be eating, so that one child in the family can go to school to get an education to hopefully make a better life for the whole family. So again, I see them all as interchangeable, but that is my focus. So for the question about all social classes, so this is where technology is really intriguing, right? Because as the last billion people are said to be coming online relatively soon. And again, I don't have all the solutions for the last, billion coming online, but the rate that people have been getting online and the rate that countries like India and the continent of Africa, countries across Africa, have been able to sort of leapfrog what we have in the US and Canada, and basically North America, in the way of having it be less expensive, better connectivity and things, is really promising. So that's one thing. What we are seeing, and I will tie in some of the pandemic stuff, because it's what my hope is with the key skills with this conversation, is that it does give you a framework that you can start to apply to lots of areas, including the pandemic. What we're seeing here in the US, and I imagine in most of the sort of developed world, is it also stands to increase disparities if we're not careful. Right? Because, here in the US, we have not handled our pandemic particularly well. I also served as the spokesperson for the Centers for Disease Control on the Wash Your Hands, Cover Your Cough campaign for years. So I did international public health, hand hygiene, infection prevention. And we have not been doing a good job in the US, which means that as much as everyone wants to rah, let's get back to school in August, it's not going to happen. Right? And as it doesn't happen, what we're starting to see is that those who can afford it can hire the equivalent of a nanny and a private educator, right? And they might zoom in, and you might have a nice little, we've got 23 people and we can all kind of sit here together. But what happens to the people who don't even know that exists? They can't afford it. So again, I'm particularly focused on it, but technology does allow us to be globally connected. I'll give you an example and then I'll move on to Isha's question here. I referenced the fact that I just joined as VP of Communications for a mentoring company based out of Silicon Valley. It's called Mentor Cloud. And the reason they got my attention, because again, I do a lot of things and I'm sort of hard pressed to commit to doing one thing, more time, more focus. But as I mentioned, the idea of mentoring to me is a caring, responsive adult. It's a relationship, it's engagement, and actually can change life outcomes, right? At all ages, right? If you have that sort of support. And mentoring in the sort of higher education, business world is really starting to prove itself. And people are recognizing that it proves itself to be very beneficial. And part of the race is to say, how do we measure the benefits, right? Because if we all feel like it's a good idea to have a mentor, somebody who's really supportive and has got your back, but we don't know how to measure it, that's a problem. But the other thing that caught my attention about mentorship is exactly how do we do this globally connected idea? Because mentorship in reality is a form of education. It's taking it out of the traditional systems per se, a lot of the time. But I could mentor somebody, again, small farming village in India somewhere, right? Like I can do those things. And in fact, the founder, who is from a small village in India, has mentored people who've gone on to like get into MIT and go on to get a PhD. And that's the sort of thing where you say, there are a lot of people racing to do that. Technology serves as access. So I hopefully, let me know if that answered your question, Matrai. I mean, I don't know if I'm pronouncing your name right, but make sure I answered your question, or if you have more thoughts, oh, yep, thank you. Okay. Let's see here. So Isha, having heard your opinion about how to be interdisciplinary has plenty of advantages, what do you think is the best advantage that you've experienced about this particular skill? Oh, interdisciplinary, that's a great question. And it's funny because I could not have come from a more straight and narrow path family. My family's very academic. Both parents are physicians, pediatricians, in fact, and they did all their training at Harvard and Hopkins, right? So the two most elite medical training institutions in the US. And so I did the straight and narrow. I worked in labs, like my summer job, my friends were working in restaurants, waitress, waiter, whatever, making some money. I worked in labs. It was just the easy job to get. That's my family friends. That's what I knew. I was interested in it. So I sort of looked a little bit crazy when I sort of took a leap in the 90s, which probably most of you wouldn't have the sense now because, the internet and technology is so ubiquitous. But in the late 90s, to jump into what then became one of the first online parenting sites, sort of parenting pediatric websites, seemed crazy because nobody was really using the internet much. right? And so when I did that, so all of a sudden I'm doing sort of the internet, like figuring out the technology platform, right? The internet as it was getting big. And then I also had other things I was interested in and that I did. And along the way, especially because the question was always like, yes, but when are you going to focus? What are you going to focus on? Because everybody's view was this funnel into a narrower path and develop your skills more and more. I will tell you that all of what I'm telling you now is true today. There's a lot of pressure to do that still, right? And I still get asked the question, that's great, you know, Laura, but when are you going to focus, right? You're all over the place. And what I now am much more comfortable saying, but also sharing with all of you is that what people like about what I do, I wouldn't know, I wouldn't be doing if I focused too much in one area. But the other part of this interdisciplinary skill, because I think it's hugely valuable, is it's crazy how much I am able to take one concept from one area and apply it to another, completely different area. And I'll give you an example. So I attend a global food systems, like the premier global food systems sustainability conference in the world, right? Amazing opportunity. I got in very early because I was consulting for somebody who was on the board of this conference, planning board. And so I would go each year to Stockholm and go to this conference. And it is the report that came out from the British Medical Journal, and it's the mix of climate sustainability, right? The issues facing the world if we don't get this under control, and taking food systems and saying this is really important, okay? So I learned a lot about food systems, everything from packaging and food waste to, you know, all the issues, right? The carbon footprint, all these things related to food and how significant it is, and meat consumption and everything you want to talk about. And with that, food systems, supply chains, a whole lot of detail. And then one year I was at the TED conference. And of course, people saw me as medical. I'd get invited to all the things where they wanted doctors to show up because there were very few doctors at the TED conference. That alone was interdisciplinary, right? And was unique for them. And they decided one year, the TED conference, everyone goes, they talk about things. It's really inspiring, motivating. It's almost like, you know, this like go on a drug binge, but you're on like a make your brain kind of spin and then go home and crash when you get done. And they decided they wanted to actually have people do something, right? Like what can come out of this so we can actually accomplish something together? Because very powerful, accomplished, you know, people who can make things happen show up at TED. So I got put on a team, a challenge team, and the challenge was, and again, I know you guys are working on challenges, but this is the shift gears into real world challenges and mixing people from all different backgrounds. I got put on a team where the question was, how do we get vaccines to the most far reaches, right? That last mile. And again, people always talk about the last mile, even for the prior question, that last mile of how do we reach those who are the hardest to reach, right? And apparently hundreds of millions of vaccines are wasted because you have to keep them at a set temperature because they don't get delivered to where they need to go, you know, on the, you know, the mule somewhere out in the distance, whatever the problem. But interestingly, what they thought was a relatively diverse group was the editor of the British Medical Journal, the head of some pharmaceutical company, the whatever. It was a really interesting powerhouse group of people. There were about 10 of us on this team. The woman who runs Da Vinci robots at Stanford, right? But nobody was outside of sort of that healthcare, medical, public health sphere. And everyone was sitting around and we were talking, this was several years back, could we use QR codes? How could we use sensors? Could we deliver mobile phones that then could scan the QR code so we could keep track of where the vaccines are along this whole supply chain? But because of my work with the food industry, I said, it seems to me the food industry has this figured out already, right? You take a big giant food conglomerate like Conagra, right? It's a Fortune 500 company. It's the parent company for a lot of brands that everybody knows. If they have a recall on a jar of peanut butter, they need to know where the peanuts came from, where they are in the process, what temperature it was stored at, which warehouse it was at, and where it was every step and every component across the entire way until it's purchased at the store, right? If they can do that, why would you not apply what the food system has already figured out in minute and accurate, you know, like efficient detail to vaccines where they haven't figured it out yet? And nobody had thought of it. And I connected them with someone at Conagra, right? And it took off from there in terms of, so again, it's just one example that I use because people kept asking me why I was going to a global food system sustainability conference But that happens, quite honestly, it happens to me all the time. You know, I was explaining to somebody about the challenge of trying to measure all these soft, non-cognitive and other skills, right? It's not a fill in the blank or multiple choice or binary answer. And I said, it's challenging, right? How do you measure those things? And I said, you know what? It's kind of like calculus. I was going to be a math major. I just didn't know what I was like, and somebody was like, oh my God, are you going to do another one of your analogies? But I'm assuming a lot of you, you know, area under a curve, right? And all you're doing is summing up smaller and smaller rectangles under the curve. Does that make sense? I can only see two of you, but nod your head if that makes sense. Did you learn this in calculus, right? Most people I knew, yep, good, I got a yup. Most people I knew in math just memorized the integral equations and how to calculate them. And they did not conceptually understand that what you're doing is saying, if you have a, you know, a curve, pretend a curve, and you drew 3 rectangles under it, you'd be missing a lot of the area, right? Like a lot of the area. But if you did 5, and then if you did 100, and then you did 1,000, and then you did an infinite number of rectangles, you are more closely approximating that curve, which means that the area under the curve is accurate, okay? For trying to measure 21st century skills, if it's sort of this soft, non-cognitive other, we are getting closer and closer to being able to measure aspects of it, which to me is we're starting to add up smaller and smaller rectangles under that curve. Does that make sense? Sharon's nodding at me. I'm going to take that as everybody understands me. But again, you could say, okay, she's kind of crazy and all over the place, which some people do. There are times I talk to people and I look like I ran them over with the truck, right? Like, oh, sorry, I didn't tone myself down. But in settings where people are sort of looking to that kind of mode, I've had people go, oh my God, that's brilliant, right? Like you mix things across realms. And if I had to say there's one thing that I do most uniquely compared to sort of mainstream, just talking to people, it's that. It's my ability to synthesize information, see patterns in it, apply it to other areas. And that's where go with your passion. And then just think, because if you're passionate about it and you learn an area, I have a couple things I'm really involved in, whether it's photography. But when I got into media, the fact that I can do photography meant I shot my own B-roll for ABC News interviews, right? Sent them to New York. I'm like, you want me to shoot my own B-roll? But I can. That kind of thing is the direction the world's heading in. And that makes you stand out. For someone like me applying to medical school in the early 90s, where I started in 1990, so late 80s, if I said that I was into photography and I like to travel and I did this other thing, but I really want to go to medical school, they would have been, she's not serious about medical school. There are definitely more and more places over time. Hang on, I dropped my phone and it's my Wi-Fi hotspot. So let me make sure that doesn't cause a problem. There are more places that are looking for that. And again, not all of them. So as you all go on to whatever your next level of education is, looking at jobs, what you're going to want to do is find the good fit. Because I live in the middle of the US, right? Very dead center. That is the heartland of America. It is not the leading edge of forward thinking innovation, right? So that if I talk like this in some areas around where I live, people are like, what are you even talking about? Like, this is, I mean, this isn't the way the world works. This is not what we see, because they're not there yet. Traditional companies, traditional education, that sort of thing. But if you start looking, you see people trying to shift towards it and you see the pieces. Okay. That was a long answer to that question, but hopefully that helped. Okay, and let me go back. Did I get, okay. Isha, did I get Isha's? Yeah, that was.
Vanessa had a question. I could just read it out to you if that's easier.
Oh, who did, Vanessa?
Yeah.
Okay, yeah, go ahead.
So she's asking, what do you think are the century skills of the future?
Well, it's interesting. The two main categories sort of fit. And again, I would like to say it wasn't just that I was fortunate when I was trying to come up with my framework and I said there were IQ skills and then QI or key skills. I was seeing patterns, and it was early enough that I hadn't had it all put together, but it fits now with what my answer would be, which is they sort of fall into those two categories. One of them is absolutely sort of the content knowledge category, and specifically around technology and, you know, whether it's coding and technology and things, because it is so pervasive. It is what allows us to be globally connected, share ideas, it's democratization of information, all of those things. So on the one hand, if you look, and I follow a lot of the workforce education sort of 21st century skill kind of chats, discussions, thought leaders, I see those all the time. take this, take how we do reskilling and upskilling, and what do we do about people who are going to lose jobs in old traditional fields that are going to get taken over by computers, right, and technology. And it's moving towards those things like the coding and the, bioinformatics and all that stuff. Absolutely, that's very valuable. It's not for everybody though. But when I talk about my key skills, the reason, and again, I kept, it's funny, my husband, whose parents are Indian immigrants, right? They came to the US with $5 in their pocket. And for any of you who are from India or whose parents are from India, I don't think it's presumptuous of me, now that I've been married into the family for 25 years, to say that wasn't his family's or a typical Indian immigrant family's view of what you do with your education. My husband carried a briefcase to kindergarten and read the encyclopedia, right? He was the firstborn in the US of like now 30 cousins, and the whole family ended up coming over time. For them, what I started out, when I started doing this, they were like, you're crazy. Who pays for medical school and then doesn't practice clinical medicine, right? In a hospital, in a clinic, like, what are you doing? But what you can see though is the shift towards what skills do you have, so that as things change, right? And it can be within healthcare, because there's still going to be sort of what we consider traditional medical healthcare jobs. How do you adapt? So when it comes to healthcare, I go to health innovation conferences. I spoke at, Singularity University's, their Future Med conference, right? XMed. And then I say, okay, but I've got all this context because I know public health and I know pediatrics and I know some of the healthcare stuff because I consulted for one of the big foundations. And I can talk about technology, and I can talk about potential uses of AR and VR in healthcare. And I can also talk about social emotional skills. That's where you say that adaptability, right? So we talked about the ability to adapt and fail and learn from your mistakes and do all those things, shifting into another area. We can run through the key skills again, because again, clearly I think those make up that other element of the skills that are really necessary. Me skills, the self-awareness, self-control, impulse control, all those things. What happens when you do this? Now we're gonna have virtual classes, and I don't know, for anybody whose camera is not on, I don't know that you're actually listening or paying attention and stuff. It takes self-motivation, right? You have to be in control of your own abilities, right? And you have to figure out how to work with other people. So you got your own, and then you've got your perspective taking, which is the we skills, and again, globally, so that what I think is appropriate may not be appropriate. That's why I always say I am well aware I talk very fast. When I speak, even in the Southern United States, much less in a country where English is a second language, I have to be really aware of what expressions people do or don't use. I have to be really aware of how fast I talk. I pay close attention to social sort of areas, because when I give examples, I try not to write out my talks. For almost anybody, I don't write out my talks. I actually just give them. Like the one I did for the keynote, that was off the top of my head. I had no notes, no nothing, except just I just wanted to remember what my point, what areas I wanted to cover. But those skills that, being able to do perspective taking and things, very important. The questioning and curiosity, right? Really important. And I will elaborate just to give people a little bit more sense when I referenced the, I said I trained in the 80s and 90s. In the 80s and 90s, I was considered very, very smart because I had an almost photographic memory. If you're in medical school in the 80s and 90s and you have an almost photographic memory, you are very smart. Because typically what somebody would do is say, okay, we're going around and seeing patients in the hospital with the attending physician, and he would say, and it was usually he would say, okay, this patient presented last night with esophageal ulcers, okay? Not terribly common to get ulcers in your esophagus. And you say, what are the top 10 causes? And one or two are kind of common, like they could be a virus or whatever. Some are really uncommon, like, some African, parasite that whatever. I mean, unusual, you don't really see it. I could remember the list, so I was very smart. Now, for everybody here, because I assume you all have one of these, right? If you have one of these, or you have an internet connection, you know the answer to the question as well as I did, right? Doesn't make you smart anymore. And that's why I reference that. Even if I have to do it quickly, I always say we're living in an information age where we're getting information through a fire hose. So you have to be curious and you have to go look for information. You also have to be able to think about asking good questions, because there's so much that you can end up, as people say, I mean, you know full well, you can end up searching for things and end up in a rabbit hole, wasting a whole day looking at stupid cat videos online, right? So you have to be curious, and then there's the motivation, right? Which is the will skills. You have to be motivated to go find these things. If you see, when you start thinking about it, tied in with the earlier question, those skills can be applied in a lot of fields, right? So the fact that I have medical training is great. It was very rigorous. I'm very interested in health and healthcare, but I am also fairly unique in being able to jump from talking about epigenetics and all of the cool new CRISPR technology, which I get really excited about at a very minute detail kind of level, into the, into the realms of what does that mean for health systems? And what does it mean about financing healthcare if 80% of traditional health outcomes are determined by something outside of the traditional healthcare system? 80%. So now that's US statistics, but I mean, that's what we're now seeing, which is, it's environmental, behavioral, and socioeconomic predict 80% of future health outcomes. And then you say, okay, I always tell people, and I always say, well, now I'm not so crazy, am I, right? Because what that means is we need to start looking outside of the 4 traditional walls of the healthcare system when we want to have good health outcomes. And I'm talking health outcomes like diabetes, heart disease, hypertension, obesity. It is not a siloed, let's just look at the blood sugar and the hemoglobin A1C and then figure out what to do about it if you don't look at the context. So to me, all these other skills let you be the context person, which is how I end up working with places like MIT, right? I could hold my own when I started consulting with MIT, the Media Lab. I could hold my own because I knew enough math and science and, biochem and all those things that I understood what they were talking about. But I was very curious about stuff. And if I didn't know it, I'd go read up on it. But I could also say, yeah, you guys don't communicate this so well. Like, let me put this in context for you. Let me tell you how this fits with what's happening in public health and how this fits with what's happening in other realms. So again, long answer, but since we have time, I figured I'd kind of give some more detail. So hopefully that's helpful for people. Harsh has your hand raised. I'm not good at hand raising.
I think Rima asked a question before Harsh, so we're just going to get to her first.
Oh,
Hers
yeah.
is in the chat. Yeah.
Do you think soft skills should be focused on at an earlier age in the education system, kindergarten, rather than studying? Absolutely. So this is the part of my typical talk that I didn't give to you because I didn't want to skew everybody into the early childhood piece of this. What I will elaborate on just a little bit, because this is usually in all the talks that I give, especially because when people are having me come in, like the Maternal Child Health Bureau, or people interested in like, okay, we keep hearing invest in early childhood, but why? Like, why are we doing that? So if we take, for example, I referenced the term executive function skills, and I think I defined it for you, but again, usually I'd put a slide up there, because here, if I said, even if I told you, would you remember the 3 defining features? Usually people don't remember them. It's cognitive flexibility, right? Mental shifting of gears. It's working memory, being able to take new information in and do something with it. And impulse control, right? Stop, think through your actions, those sorts of things. Those 3 skills, so executive function skills, take place in the prefrontal cortex, right? So the kind of front part of the brain. They are in competition with the part of the brain, the amygdala, which is your fight or flight response, right? The danger, danger, be careful, get out of here. And the way I usually do this in my longer talks is I say, okay, there is, Sharon and I are standing together on this virtual stage, and we turn around and we see wouldn't it be cool if I could do this, like a saber-toothed tiger riding behind us. And so we see a saber-toothed tiger coming. If I were to stop and think, I wonder if he ate, lunch already, right? Because if he ate a big lunch today, he might not be so hungry. Then maybe I can finish what I'm saying before I have to run. Or I could say, well, I wonder if Sharon's got tennis shoes on, and if maybe she's got heels on, I got tennis shoes. So maybe if I just run faster than Sharon, then I'm still going to be okay. You know what happens? We're both lunch, right? Like, you don't have time to think through things like that. So from a sort of survival Darwinian standpoint, our brains are wired that when our amygdala kicks in, we feel threatened, we stop thinking with our prefrontal cortex, okay? Now, the reason I'm giving you that background is because the neuroscience is really strong and very compelling in these areas. But what we now know about it, so first of all, we know prefrontal cortex, we know the amygdala. For me, the amygdala is continuously triggered in kids born into poverty facing adversity, okay? And so it's survivalistic if a child is really reactive, if they've been brought up with abuse, neglect, under threat, right? Their brain gets wired so that that amygdala is on high alert, ready to spring into action. And you stop thinking through like, well, what should I do next? And there's some things that are different about this. That is great for a kid living in a threatening environment where it could save their lives. And then they get to school and it does not serve you so well. I use the example sort of as the extreme so people can see what I'm talking about. But the kid in a high school where there's gangs and violence and whatever, and they're walking down the hall and someone hits them in the back, you know, like, hey, how's it going? And they turn around and stab somebody, right? Something where it's that quick flip into action and you don't think through your actions. So knowing that concept, here's what I will tell you. The most rapid rate of development of executive function skills occurs between the ages of 3 and 5. Okay, we all want those skills, right? Cognitive flexibility. Okay, when we're living in a rapidly changing world, if your brain can't switch gears quickly, you can't switch gears quickly. Think about what all the stores, every manufacturer, the manufacturers that have to flip and switch into making masks. Clearly in the US, not enough of them, but you know, things where you have to switch gears in a very literal sense. How do you do that? Like, that's a big thing that, you know, if every day you've been going in and making the same thing and all of a sudden you have to revamp the whole factory and switch over to something else. If you need to do that in the real world, your brain has to be able to do it in a cognitive sense. And we do that all the time, you know, switching gears. You had a plan, but now you got new information in, right? And then you have to switch gears and switch into something else, okay? If you can't do that, that's a problem. So most rapid rate of development is age 3 to 5. The other time when those two things get out of whack, I would say if anybody was looking at me where I could see it, can you guess what that is? That's adolescence, right? Teenagers, impulsive behaviors. The amygdala is much more active, the impulsive behaviors, and the prefrontal cortex is not as active. And in fact, what we also see is that those executive function skills don't typically fully develop until it was mid-20s, and we're sort of effectively pushing it back. However, we're doing this, maybe not doing such great things, to the late 20s. Okay, so you all probably still have some ways to go, some of you, but the point is, and some people never develop them, right? In the adult world, I tell people this is the do not hit send when you're angry on an email, right? Stop, wait till you're not upset, because again, when you're upset, frustrated, angry, you are not using your prefrontal cortex to think through, is this really a good idea? What if I do this? What are the ramifications? So back to the question, because again, thank you to Rima for asking me this, because this is what I spend a lot of time talking about. If we know we want these skills, and every key skill I talked about in my book, in the toddler brain, I break it down into the literal developmental milestones and the neuroscience of how those skills develop in the first 5 years, okay? Or in some cases, things like questioning and curiosity, right? The why skills, how we literally train it out of kids, and then we wonder why they don't have them later, right? Because if there's only one way to do something, or there's not enough time, or a kid who keeps saying, but why are we doing this? Why don't we do it this way? Why do we, right? If that's an annoying child, as opposed to, wow, this kid's really engaged and really thinking this through, we train it out before anybody's paying attention. So especially when I talk to like business audiences, tech audiences, what I use is the example. So here, at least in the US, middle school is when people say, let's teach STEM or STEAM education, right? Because that is what we want. We want that science and the technology and engineering and math. And now people are realizing that arts actually teaches those other elements, right? Like the creativity and stuff. And so they say, let's start in middle school. So 7th grade. So let's say, what is that? Like 12, 30, 40, 50, like 15-year-olds, right? They say, let's start, I'm getting them the years wrong, whatever, 10, 12, whatever it is. And I keep saying, great, like those programs are great, but you're not looking early enough. Because if you say this, why we think it doesn't start earlier, I do talks on how planting a garden is STEM education. You can do math, you can do all sorts of science, like the hypothesis, like doing your null hypothesis, and you can teach kids tally marks, and you can do all these things. You just have to be able to distill it down to a basic level. And usually going from business to early childhood is such a long stretch for people that they don't see how it's connected. And in fact, when I sat down to come up with my TED Talk, which I thought, okay, am I crazy? Like, I'm just tossing this out there, but there was nothing like it. And when I sat down to write the toddler brain, my thought was, I'd heard enough business people say, we're hearing early childhood is so important. We need to invest in early childhood. And then they'd say, but what are we really talking about? And because I'd done a lot in media, this is again, crossing sectors, because I was promoting early literacy as a pediatrician, I got invited to do TV interviews to promote a fundraiser. And then they said, oh, you're really good on television. Do you want to come back? And so for 7 years, I did a parenting segment on our biggest, network affiliate in Omaha. So because I had done all of that, that's where I was like, I will make it very concrete for you. So let me understand, again, using empathy, perspective taking. So that would be we skills. I said, where are you coming from? How do I frame this in a business sense so it makes sense to you? And again, that's how I got here, right? I mean, so again, it's the crossing disciplines and the perspective taking. So I say I apply the skills that I promote, but absolutely. And what we're seeing, and it's not just the US, I'm seeing it globally. I mean, I was supposed to be going in the fall to keynote the national conference in Australia on early childhood. I was supposed to be doing I just did top 100 business leaders in Mexico I presented to. I did a global business leaders summit not too long ago. I've done congressional briefings on this. Everybody is racing towards early childhood. And then the data is supporting it more and more that you can predict children's future life outcomes. And in the US, it's pretty dismal where you can say the zip code you're born in, right? Poverty and sort of the environment can predict poor outcomes for children fairly reliably. A caring, responsive adult is the single most important factor to get them off those trajectories. And it's that application of trusted relationship, helping form those skills, right? That they can be used for lots of things that then get them so that they can have improved life outcomes. And that's where you see, I think I mentioned briefly, the study that my Penn State colleagues, and it's actually how I got my faculty appointment at Penn State, is I referenced their study and they were so excited about how I was able to distill it and explain it in a way that got it a lot of attention, that they asked me to come out and visit, and now I work with them. And I work with the person who runs the human-centered design lab at Penn State. But that was the study where they looked at a bunch of 5 and 6-year-olds, social skills, right? And the playing nice and sharing kind of skills. And they looked at all these future life outcomes at age 25, like, the high school graduation and the, sort of education attainment, graduating, earnings, all those measures on that kind of education business trajectory. But also they looked at health outcomes. They looked at teen pregnancies. They looked at drug use. All of them were predictable and more accurate than most measures that anybody uses now, based on those sort of, that what I call, sort of the key skills and the social emotional skills. So there you go. So yes, thank you for that question. And there's lots on it. And so Rima, if you're interested, you might be interested in both my TED Talks that I gave. I think I actually have a third one on there somewhere, but the TEDx Omaha talk I gave 5 years ago was like the start of me you'll hear the start when I was starting to see this big picture, and it's called 5 Connections That Will Change Children's Lives. Because again, that's what I was focused on. And then people said, what are you doing writing a book about business and how, because some people thought I was saying that parenting, that we should be copying the business world in our approach. So there are some people who think I am horrible. Like, what a horrible idea that we should treat our kids like future workers. And I'm like, no, you're missing the point. What I'm saying is that even the business world is recognizing the value of these skills. And so I'm going to put this in a language that the business world understands, because here's the deal. If business and policymakers don't understand the importance, it's never getting funded. And this gets back to the question, I can't remember Matrai's question. Yeah, how do you get to all classes, social classes? If we don't make the case in a way that people understand that it's really important across, for everyone, then it's going to be the haves get it and the have-nots don't, right? Because it takes funding. And early childhood is very poorly funded. And so what I was trying to do is make the case in a way that people would understand. And business people and, of course, policymakers have a lot of sway. So the fact that I'm getting business people to really be engaged in this conversation about why they should be literally investing in early childhood, not just within their own companies and, paid time off and paid family leave and all those sorts of things, but within their communities, like supporting programs in their communities to make sure all kids have access. It's because I think these key skills, it's not that you can't teach them later. I referenced this, I was getting confused with which direction my curve was going. You can always teach them later, but the example I give is if you consider the brain as the electrical wiring of the brain as the wiring of a house, It's entirely possible to rewire a 100-year-old house. It just always takes longer, costs more, and never ends up quite as good as if you get the wiring right before the walls go up. That is true of the wiring of the brain, right? So the caring, responsive adult is literally the brain architect, because it is the interaction that causes connections, the developing neurons to connect in certain patterns in the developing brain. There you go. So there, I got my somebody asked. I didn't just kind of subject you all to that, but that is where, to me, I keep going, oh my God, do you see how this all fits together? And I then try to convince people that I'm just not crazy, but that it all really fits in one big picture.
Thank you for that. We have about 7 minutes left, so we're gonna take this last question from Harsh.
Good, because Harsh had hand raised for a long time.
Yeah, no worries.
Hello,
Harsh,
can you hear me? Perfect. All right, so like in your keynote and like in this like workshop that we have, I heard you talk a lot about like tech and health specifically, and I found that really cool. And my question to you is like, how do you think we can like go about educating and empowering the next generation to tie these two fields together? For example, like I'm a computer science student, but I don't really enjoy studying like the health or science aspect of it. So like, would you go about trying to get students that are in the technology engineering field and get students in the health field and get them to collaborate? Or would you try to create or like empower students to learn both at the same time and then solve those problems?
Oh my God, that would be the thunderstorm I was talking about. I don't know if you heard that, but that was so loud. I've never been in Chapel Hill, North Carolina before, but apparently they have really impressive thunder and lightning storms. That is, so when I went with MIT Media Lab and collaborated with them, I was actually doing a sort of collaborative maker workshop, kind of on steroids, week-long trips to India in preparation for the Kumbh Mela, which, if people don't know, is one of the biggest mass gatherings on the planet. And of course, if MIT comes in to these locations, you know, and they're doing this, people took trains and they took buses and they took whatever, and they came and they'd spend a week and they barely slept, and it was all the IIT students, and it was all that, you know, computer science and stuff. And their idea, a little bit of mixing up the teams of collaborators, where some might be electrical engineers and some might be, you know, a different type of engineer, and somebody else might be a computer scientist. That's where I fit in really well, because I love that stuff and I know enough of it, but putting it in context for the real world was really important. So it's a great question, Harsh, because here's the thing. I have read the US tax code before, which is like the most boring thing you could ever read, when I was motivated to try to do my own taxes before I had got complicated, right? Or I was just doing this thing on healthcare, trying to figure out how do we make sure everybody gets coverage in the US, because we've got the system where we don't, and it's really sort of pathetic. And I started reading the Medicaid manual. Again, something I thought was completely dry and boring and not my thing, right? I'm a people person. So what I first say is, you might find it more interesting as you go along if you have a reason for it. And it doesn't have to be healthcare, for example. It could be in any area. If you have a broader perspective, but you're a computer science major, then being able to apply it in a context is great. The other thing I will tell you, and I tell my kids this quite a bit, is if it's an area you're not particularly interested in, make yourself read a book so you have some context. I've done it and I find that I'm more interested, but for example, I read the books on AI when they come out. So for example, Kai-Fu Lee's book, AI Superpowers. All right, Kai-Fu Lee spoke at TED. I was like, well, that's cool. Well, it turns out he's like one of the creators of AI, or at least people credit him. He trained at Carnegie Mellon in like the, I don't know, 70s in the US, but he's half his time China, half his time US. He's been at Google. He opened up Google China. He runs like $1 billion investing firm in AI in China now. Okay, so he's a powerhouse, but his book is the kind that I like, because it gives you I'm going to tell you the story of AI, and sure, you may have heard this, and you may have heard the story of AlphaGo, and the computer beating the human, and then the computer beating the computer and stuff like that's great. I hear those things, but that book is very easy to read, and it ties it all together. And at the end of the book, I always say, spoiler alert, first of all, China's going to blow the US away in terms of competing in AI. This is my take on the book. But second of all, he concludes that the only way we get AI right, so that we don't have increasing disparities, because he or she with the most data wins, right, in the AI world. And again, you'll see, I know enough about AI that I can say this to somebody who's studying computer science and not sound like a moron, hopefully, right? But I can add the perspective. But then when I get to the end of the book and Kai-Fu Lee is saying, the only way we get this right is if we start valuing the things that make us truly human, right? Because computers are going to blow us away in everything else, right? All that, again, that rote memorization, fill in the blank, binary kind of tasks, computers can do. But in the social sector, and I went, there you go. We are saying the exact same thing, because if you look at my key skills, those are the skills that make us human, right? Our ability to, like the subtleties of communication and expression and social emotional stuff. Computers are at the level of like a 2-year-old in terms of their ability to even simulate human speech well, right? And even then it sounds a little bit like autistic speech. So what I would suggest is, it's not like I'm going to go I've been tempted. I'm kind of a little bit like maybe I should go take a coding course. Maybe I should go do this course. And I've been tempted, but at least I read books like AI Superpowers to get a big picture grasp of AI and how the continuous story. Same thing. I saw somebody earlier here saying it in sort of the bioinformatics and things, but the book, The Gene, right? So the book, The Gene, tells the whole history of sort of that molecular biology, genetics sort of. But it's not, I don't want to say it's dense. It's not like beach reading, but for anyone who's curious, you read that book and you've got a really good sense from the Mendelian genetics and the fruit flies that Mendel was studying for, genetic variations, all the way up to CRISPR. It tells you that story. That's what I would do so that you have at least enough of a framework. And then you can jump in with your computer science knowledge, because what I do is that's how I end up partnering with all these people in these areas. Is I've got what they don't have, but I have a deep enough appreciation of what they've got that I don't say stupid things that don't connect with what they're. And again, I don't want to say stupid in the way, because I always do. There's no such thing as stupid. You want all the ideas coming in, but I can already tailor them for the context that they're working in. So that would be my suggestion to you is, yes, go deep in areas. Listen, I owned a childcare center for 10 years. People are like, what are you doing? And that's not all I did, but I'm one of the only pediatricians in the United States that's done what I've done, right? I can speak pediatrics. I'm a spokesperson for the American Academy of Pediatrics. I've done high-level media. I've written children's books and parenting books, but then I tell you these other things. That's not to say like, oh, I'm so great because look at all the things I did, but I've loved children. So owning a childcare center, well, oh my gosh, I love the kids, right? Like I missed kids because when I wasn't seeing patients. I love to travel. So I started giving talks and people find me, and all of a sudden I'm giving these keynotes around the world. That was just, and a lot of this, by the way, almost everything I'm telling you now, yes, I'm a pediatrician. Yes, I say a lot of this is self-taught. I did not take a course. I didn't study. I didn't get a PhD specific to these areas. I dove in deep when I was interested. So Harsh, I would suggest that you kind of do the same thing, which is even if it's something you think you should know because you see opportunities in the healthcare world, start looking at them, right? Or just get like get on like a listserv or like an e-newsletter that keeps you abreast of stuff. If people are interested in sort of the leading edge innovation side, I mean, I follow some of the stuff like the X Prize and Singularity University's got one, and but just find things that interest you. And even if you don't go deep, keep tabs on them so you see where they're heading.
Yep, that answers my question perfectly.
Great.
Alrighty. It is 6 p.m. now. Seeing as there are no other questions, I think that's a pretty good place to end. Unless Dr. Jana, you have something else to add.
Oh, I was just going to say, I'm really glad that I didn't have to do all the talking for an hour, because hopefully, I mean, not too many people signed off. Hopefully that was useful to people, because again, I am way more interested in having real conversations with people, because that's sort of the premise of what we're talking about. So I wish we could have all joined each other in person, but I'm honored to join you all. I'm glad I was able to make it.
No, thank you again on behalf of Circle as well as all our participants. We're a small scale event, and we really, really appreciate someone of your caliber to come in and really talk to us about how your take is, especially on intersectionality within education and healthcare. Well, yeah, thank you so much.
Here, let me just add for everybody on here. It's easy to look at what I do now and go, okay, I'm high level doing all these things. But when I started out, I cold called the most well-known pediatrician in the world, ended up consulting for him, and co-founded the Dr. Spock company in the 90s, right? So he was one of the top 10 most influential people of last century. And I cold called him, and I was a nobody. I was a medical student. I wanted him to come speak. I weaseled my way in, right? So part of this is what you all are doing at this conference so resonates with my philosophy, is that it doesn't even have to be more than what you're doing now. This is it. You're challenging yourselves. You're doing literal challenges. You're kind of expanding the way you think about things. That is going to get you where those are the skills that you need. So again, I'm happy I could join in. And again, usually I wouldn't have had terribly much spare time, but you caught me in this lull where I thought, oh, I'd love to join in, because good luck to all of you. It's great that you're doing this.
Thank you so much. Yeah, we're so glad the timing worked out, especially with your moving, and like, thank you for making time for us.
Sure. This isn't exactly my keynote and workshop attire and setting, but you know,
oh, good.
I made it work.
You really did. We, again, like, thank you so much. You'll be receiving more emails for us afterwards. But to all of our participants, this is our last event for the day. We do expect your submissions for judging. They're all due tomorrow at 8 a.m. The submission link and the rest of the information for the case and the submissions are all in your email, as well as on the Participant Compass website. Again, if you have any questions, please, again, feel free to email the Circle email, which is info@hellocircle.ca, as well as events@hellocircle.ca. But yeah, thank you so much. We'll speak to you soon, and to the participants, good luck with your case tonight. There's still going to be lots more to do tomorrow, so do stay in touch and check your emails. Take care.
Take care.
Bye. Thank you.
Bye.